Hi everyone, I'm Lisa McGarrigle, a research fellow with the Healthy Aging Research Group in the University of Manchester. And today I'm going to talk you through a briefing paper we prepared for the Department of Health and Social Care earlier this year. Next slide, please. So with the COVID-19 pandemic, there is some concern that stay-at-home measures to reduce transmission of the virus is going to have adverse effects on older people's levels of physical activity. And this could result in deconditioning and an increased falls risk. So in April, we prepared a briefing for DHSC on the potential use of digital technologies to increase physical activity during COVID-19. So this work predominantly drew on two pieces of work that were underway at the time. And the first was a review of reviews on the effectiveness of mHealth and eHealth technologies in the promotion of physical activity. So basically interventions that were delivered or enhanced using mobile applications or the internet. The second was a rapid review of apps and websites with the potential to support older people to engage in strength and balance exercises independently in their own homes. Next slide, please. So the review of reviews firstly, what we did here was we prepared an evidence summary based on 4 high quality reviews. 3 of them were systematic reviews with meta-analysis and 1 a systematic review. The interventions included wearable motion sensing devices that tracked physical activity levels, so things like accelerometers and pedometers, as well as apps on smartphones or tablets that generally synced with wearable devices. We found that there's evidence that activity monitors are effective in increasing physical activity levels. Evidence for the effectiveness of apps, however, is perhaps less clear as many studies were underpowered. However, the results did reveal trends for a positive effect of apps on physical activity levels, sedentary time, and also physical fitness. So overall, activity monitors and apps did appear to be acceptable to older people. And there's evidence that people do adhere to their use, at least in the short term. Next slide, please. So our Map the Apps review was a rapid review conducted to identify and evaluate apps and websites that might have the potential to support older people to engage in strength and balance exercises. And this would have been independently at home. So we evaluated 13 apps and 24 websites, and we assessed the current evidence base for each of these. We conducted quality assessments in relation to their content, and we evaluated the use of behavior change techniques in each. So based on this evaluation, we are able to recommend 4 apps and 6 websites listed here to older people or healthcare professionals who are looking for substitutes to face-to-face delivery of strength and balance exercise classes. Now, it's important to note that at the time of the review, there were no RCTs or other evidence for the effectiveness of any of these apps or websites in falls prevention. However, all of the recommended apps and websites do demonstrate exercises that have been used in evidence-based falls prevention programs already. So programs like Atago or FAME. Next slide, please. So finally, given the current restrictions to face-to-face exercise classes, it's very likely that digital delivery will be better than no delivery at all. It's important to emphasize that this is a rapidly changing area, and the apps and websites we've recommended here might change in the coming months, or additional resources might become available. So this research really reflects what is available to people right now. And for the immediate future, these resources could be useful for those who are already familiar with strength and balance exercises and have been previously receiving face-to-face delivery. Also, those who are relatively healthy and are comfortable with using technology. And on this point as well, consideration must be given to the fact that older and disadvantaged sectors of society might be less likely to have experience with such technologies. And so these groups might not be as easily reached using these kinds of interventions. And finally, these kinds of resources might also prove useful in a rehabilitation context following a hospital discharge, where the use of digital technologies could be perhaps explained face-to-face to the patient in hospital prior to discharge. So I'll leave it there.